Today there was a lot of query about anxiety and fear. And now today, see, if I take anxiety and fear, it would be take so much long time. But I just wanted to give one idea कि how to take the rubric anxiety, how to take the rubric fear. Please go and study. And if you have any doubts, you can always get back to me. So today there was one more question, sir. What is brooding, and how to take rubrics of brooding? For that, you have to first understand what is brooding. ब्रूडिंग क्या है और ब्रूडिंग में क्या क्या हो सकता है, और फिर लगे तो हम देखेंगे कि ब्रूडिंग में दवाई क्या सोचना है, और ब्रूडिंग में व्हाट वी हैव टू थिंक इन ब्रूडिंग. If you see a literal meaning of brooding, literal meaning of brooding means what? If you see in the dictionary also, it is said that it's deep thought about something. Deep thought about something. You are thinking deeply about one thing that makes you sad, that makes you angry, that makes you worried about things. Hello, are you with me? Whenever you're online, you can start asking questions also, So this is brooding. In deep thoughts, that thought is making you sad, that thought is making you angry, that thought is making you worried. Immediately, then you have to differentiate between sadness, anger, and worried. If you open the rubric, brooding, see, there are a lot of remedies for. But what is the use? I keep thinking about illness. Why did I get diabetes? Now maybe I'll get some other disease because of diabetes. Brooding. And now say I've become so weak. I cannot endure exercise. I come 5 o'clock at home, and I'm tired. I feel so much tired after this. And he goes on and on. After the case taking, of course, we had so many rubrics to think about. I took one of the rubric which I entered the case was brooding over his illness, brooding over his condition. Whenever you take the first rubric, I always say that is called as the core rubric. The core rubric we got brooding over his illness, over the condition. We prescribed the patient phosphoric acid. I started with 30, then 200, then repetition 200 monthly, then 1 m. Now the patient is still on treatment. He was taking 4 anti-diabetic medicines. Now he's off the medicines. His sugar level is controlled, and more so ever, he is very happy now. His strength has come back. His thinking process has changed, and is much better with homeopathy treatment in 6 months. This is the importance of understanding brooding, and then we can go forward. Hello, are you with me, everyone? Hello? If you understand, just give me one thumbs up or 100%, so that I know that you are understanding the meaning of brooding. Otherwise, everything nitramur, it's not that. I'll discuss one more case so that I'll be able to make you understand what is the meaning of brooding. There was one case, a case of neurogenic bladder. Yeah, neurogenic bladder. Matlab the patient had a problem of urination every time. So he thought that I was very anxious, so that's why I get urination. And the patient told, doctor, whenever I get stressed, I have to go for urination. He was a homeopathy doctor only. And he said, sir, we have remedies for anticipatory or nervous diarrhea, but there is no medicines for nervous urination. Now what to prescribe, what to give? It is very difficult to prescribe to homeopathy, because he knows everything, he feels that way. And he says, sir, I am, argentum nitricum patient since past, and argentum nitricum has helped me so much. So I said that if you are argentum according to you, not according to me, So I'll just complete this, Dr. Padde, and I'll just go. So he said, sir, mera, problem kya hai? I feel that I should go and start allopathy practice. Let us see what happens. I like to go to places where it is haunted. Matlab jahan nahi jana, not allowed. I keep thinking what will be there if I go, and whether ghost will come, how will I react with the ghost, and what time I will go there. I keep thinking. What if I do allopathy practice and I'll be happy that nobody catches me because I have a lot of contacts. And these type of things used to tell me, and I keep thinking over it again, these type of things. I said, okay. I said, surprisingly. Now, if you understand this brooding, I gave the patient plumbum metallicum. Believe me, plumbum metallicum I started with 1M potency in the first month only. He said, sir, I'm 50% better. And tell me the name of the medicine. Of course, for homeopathic doctors, I never tell the medicine, because if I tell the medicine, then they feel, sir, I am this drug, I am Rata or what? I am Ratakar? No, I am brilliant. I am not Rata. I am not this. So very difficult to tell the name of medicine to a homeopathic doctor. I gave the patient plumbum metallicum 1M single dose, 50% better. I think within a span of 4 months, he was completely better. I repeated plumbum met 1M twice in my in the 4 months. What rubric I took for prescription? Brooding over forbidden things. Brooding over forbidden things. If you have the repertory with you, if you see brooding, if you see forbidden thing, forbidden means not allowed. Not allowed. This is the meaning of forbidden. So brooding over forbidden things. The only remedy, if you see number in the repertory, is plumbum metallicum. Plumbum metallicum cured the case. There is one more rubric very close in this for plumbum also, that is groping in the dark. Andhare mein dhoondna, where to go, what to do, what will happen, groping in the dark, that is also plumbum metallicum. If you must have attended my webinar, I had presented a case of wrist drop, and plumbum metallicum had cured that case. Let us go forward, Dr. Simran. Yeah. Good afternoon, sir. Knee pain with sanal fluid decreased. Case is 60 years, female, pain was from rising from seat, moving, sitting, walking, bending knees, ascending and descending with sound, sir. Everything is there in the patient. See, knee pain, yeah. So in this case, see, 60-year-old female, post-menopause, sanal fluid decreased. You can start thinking about first the hormone level of the patient, check it, and in this case, 3-4 remedies which come to my mind, doctor. First is, of course, Brahmi alba. Second is ascending, descending. Yeah. Second is Calcarea carp. Third is guaiacum, and fourth is Aristolochia. Think these type of medicines. Yes, Dr. Babal, happy new year 2025. Sir, kindly tell some medicines which covers 3 symptoms. Severe anxiety. One feels that if he sleeps, he will die in sleep, together with extreme sadness and negative thoughts, but suicidal. See, a simple, I'll tell you, whenever you are treating a case of anxiety, I have told you before also, anxiety is basically a storic rubric, and the patient feels he'll not get up only. So this is a case where the patient has to have some cause, because the anxiety is showing some syphilitic symptom. The first 2-3 remedies that you should think about and that matches your case, first is arsenic album, second is phosphorus, and third is kali brome. Of course, there are a lot of remedies, Dr. Babal, thank you. Successful 2025 to all of you. Yeah. 25 years girl with severe anger, throwing everything she thinks negative. She hated her mother, father, brother. She attacks them. Oh, so your patient becomes like in anger. If you see, anger rubric, I think I've told you this. Anger throws things in anger. Anger throws things in anger. First of all, you have to complete that. So whenever you have a remedy, whenever the patient says that he or she throws thing in anger, you'll be surprised. There is a remedy which you will never think, that is Staphylococcus aureus. You have been taught Staphylococcus aureus, what? Case Staphylococcus aureus, subdued his warmth and then goes trembling. But Staphylococcus aureus in anger throws things. So first remedy was think about Staphylococcus aureus. In your case, it is a child. So it has to be Sina. Sina also, if you go to Sin Mater Medica, Sina also throws things in anger. Third remedy, of course, the elder brother of Sina is Chamomilla. Then you must think about remedies like camphor, or you must think about remedies like tuberculinum. Of course, there are a lot of other things, but these are very important to understand and prescribe. Okay. No suicidal thoughts. Okay. Still, the remedy for me would be same, Dr. Nitin. Arsenic, phosphorus, rustox, viratrum, the calibrum. These are the remedies you can think about. Arsenic, see, neurology, आपके केस में patient has a very severe problem, so you have to go from 1 m 10 m potency. If you go 1 m prescribe 2 times a day for at least for 2 days, then immediately shift to LM potency. Arsenic helps 0 by 10. Start with 0 by 10. It will not work below 0 by 10 because you already give 1 m potency. So 0 by 10, first give arsenic 1 m 2 doses, 2 times for 2 days, and then give arsenic album in LM potency. Okay, that is very, very important. Ram Prasad, okay. Let us go forward. There was a bit disturbance here. Yeah. So I hope you understood. Now, can we go to brooding again, or there are some questions? So I hope you understood plumbum metallicum, my dear friends. Plumbum metallicum over forbidden things. Do at least write something, so I know that somebody understands. Otherwise, मुझे समझ में नहीं आता कि लोगों को समझ में आ रहा है कि नहीं आ रहा है. फिर मेरे स्टूडेंट्स बोलते कि सर आप बहुत फास्ट बोलते हैं, शायद लोगों को समझ में नहीं आता है. आई होप इट इज नॉट द मैटर. और फिर कोई मुझे फॉरेनर बोलता है कि सर प्लीज स्पीक इन English because we can't understand Hindi. And some doctors from India say, sir, please speak in Hindi, we can't understand English. So there's a problem everywhere. I hope you understand. I'm trying to, balance all the situations. Okay. Because I'm not taking webinars now because of the paucity of time. So I have to complete everything what I want to share in this half an hour. Now, one thing. There are a lot of people, who will come to an OPD and say, Doctor, please give me something for my asthma, please give me something for depression, and I want to get fast relief, otherwise what happens if I have asthma, then I'll have asthma, I'll have to take inhalers, and that would be not better, then I'll have lung fibrosis, then I have to take oxygen for 18-20 hours, and then fibrosis cannot be cured, so I have to take medicines for fibrosis, then those medicines have a lot of side effects, my friend got kidney failure because of that, so please treat my asthma please treat my asthma. See, yeah, Dr. Babel, that's why I'm going English Hindi both, That's why, Dr. Babel, we have to start a webinar, the Zoom meeting again, for the foreign delegates. I have beautiful cases to, tell you all. So this is the case. Now, the remedy is ignitia, the remedy is naja. What is the patient trying to tell you? Doctor, I have depression, please cure my depression. Otherwise, I can get bipolar disorder, and then I can get obsessive compulsive disorder. If that is not cured, then I have to take ECT shocks, Yeah, sorry, there was a problem in the internet. So there was a problem in the internet. So I was telling, if the patient suffers from depression. Hello, are you with me? It has come. Hello, are you with me? Sorry for the interruption. So I was just telling you that the patient has depression, and he says, sir, please treat my depression. Otherwise, what will happen? I'll get bipolar disorder, then I'll get schizophrenia, then I'll be in a lot of medicine, then I'll have to be given shocks because I've seen my patients having a shock. So treat this properly. What is the patient trying to tell you? He's actually not suffering from fibrosis of lungs. He's not suffering from bipolar, but he's thinking that he might suffer. There's a beautiful rubric in brooding called as brooding over imaginary troubles. Brooding over imaginary trouble. The remedy can be naja. The remedy can be ignitia. Of course, I think Lilium Tech is also there, but I'm just telling you about the brooding rubric. Hello, are you with me? Okay, there is a question. My father, 82, has lost his appetite. Whatever he eats, he feels burning in chest at night. He has constipation, sir, poor digestion, used to allopathic. Yeah, so Dr. Padde, you are lucky that your father is with 82 years of age, still healthy. Try to help your father, try to give him medicines. In this case, because of atrophic gastritis, there is a lot of problem with the enzymes and the vitamins. In this case, if I tell you, I normally start with vitamin B12 in 30 or 200 potency repetition. That has given me very good results. Okay. Secondly, you can think about remedies like alfalfa or aminosativin potency. You can also give your father, alfalfa 3x potency or aminosativin 3x in trituration in repeated doses, because in this case it is atrophic gastritis. And then you can reassess the case, and then you can think about remedy, consultate remedy, and prescribe in this case. But In acute, you have, it is important that you at least have that first effect in your patient, so you can think about these medicines. Okay, Dr. Padre. Yeah, GERD also, these are the similar problems. In GERD, it is very important that the sleeping position has to be propped up. Yeah, Dr. Nitin, thank you. So let us go forward. There may be some questions, which I would have missed. But if you are understanding brooding and you understand the remedies, like I told you about phosphoric acid, I told you about, ignitia, I told you about veratrum, naja, plumbum metallicum. So these are brooding, There's one, there was one patient, let me tell you that case, There was one patient who came to me and he used to think, sir, I don't want to go to the bathroom because, if I go to the bathroom and sometimes the flush is not working properly and the stools come up. It has happened 2 or 3 times in my practice, in my, in my house. I feel very dirty. That's why when I go outside, in the hotel, I first ask if the flush is working properly. Otherwise, the stools, I don't like that, So I just keep imagining what will happen. This was the case who came to me. So this is a question for you. You have to tell me what is the symptom we take for prescription. Forget the remedy. What is the symptom which I took for prescription? Okay. I hope you got the question right. Sir, also tell some medicines which one person is afraid of heights and also have phobia of going downstairs the stairs. See, whenever you have a person having phobia of heights is very normal. Dr. Narula says, sorry, Rubric, I never take that for prescription. Previously, I used to take fear of heights, fear of downstairs, fear of cockroach, fear of lizards. Every patient would have that. So don't take that. Now, fear of downstairs. I'll just give one symptom, Dr. Nitin. Just think about it, This is implied rubric. Downstairs matlab going down. If a person has a problem कि एक वर्ड बोलता है पेशेंट, डॉक्टर साहब मेरी इज्जत खराब नहीं होनी चाहिए, इज्जत खराब नहीं होनी चाहिए, भले मैं आज ये स्टेज पे आई हैव रीच दैट पोजीशन, अब भले इफ आई डोंट अर्न मनी, डोंट अर्न फेम, बट मेरी इज्जत खराब नहीं होनी चाहिए, माई एस्टीम शुड नॉट गो डाउन. सो आई नॉर्मली टेक that esteem rubric when there's fear of going down. Understood? Borax has a problem, fear of downward motion. Have you ever given borax for fear of downward motion? Maximum answer would be low. Such an important symptom of borax of fear of downward motion, but we have never prescribed. People will come and tell you, when I'm on a giant wheel, when I come down, there's something butterfly in my stomach, so please give me medicine. So previously, 20 years back, I used to give borax, nothing used to happen. I used to feel, oh, the remedy doesn't work. But it is the inferiority complex, the esteem problem the patient is going through. That's why he has fear of going down. Dr. Nitin, hello, are you with me? Everyone, I hope it is not becoming too much. This is implied rubric. Implied rubric, my dear friends. I hope inferiority complex, this is the meaning of the rubric. Then you can think about borax. Otherwise, borax, if you see borax in your practice, Allen's keynote, first symptom borax, it is written. What is the first symptom? Great anxiety from downward motion. When the child is laid down, yeah. Potency. I am not telling borax, doctor. I think you have not understood what I am telling you. Borax is there. You can give borax 30 to 100 potency. I don't know what it will work or not, but inferiority complex. That is what I'm telling you. You go horseback, horse riding, going downhill. The borax patient has a lot of anxiety. But I would ask you a question: who does not have anxiety? Most of the people going downstairs, looking downstairs, हम जब पहाड़ पे घोड़े पे चढ़ते हैं, coming down, people have anxiety. What will happen? What will happen? A lot of people have anxiety. Everybody is not borax. So if it is very much pronounced, very much out of control, then you can think of borax 200 or 1 potency. But this is downward motion. Borax basically is inferiority complex. Okay. So Dr. Nitin, you can start with 200 potency. Then as the results come, then you can give 1 potency. Okay. Can we go forward? Of course, borax. If you ask me mathematics, I'll start mathematics of borax. But we don't want to waste time in borax. I was telling you something about brooding. Okay, I had a case where the patient went in a hot air balloon, and the patient was very very happy. But when the balloon started coming down, the anxiety started, and the person told her, "You are so happy when the balloon was going up. People don't have anxiety while coming down." Then that is borax. Okay. Yesterday I gave borax with bleeding, backward emulation, and chronic irritation. Patient took dose, but it seems now better with borax. Very nice. Yeah, those symptoms are there, Dr. Barbel and borax. There is no doubt about it. I was just telling you something about implied rubrics. If you see borax in Allen's skin, it is written apthe in mouth, tongue, inside the cheek, easily bleeding when eating or when touched. It prevents child from nursing. The mouth, because of which becomes very hot. There is a lot of dryness and thirst. Cracked and bleeding tongue. That is borax. Wonderful description of borax, tongue or mouth, you can say, in Allen's keynote. So well done, Dr. Barbel. You keep posting cases, so we also get some motivation that also works. Thank you so much. So let us go forward. In fact, just something crossed my mind about borax. I'll just share with you before I start again on brooding rubric. Borax, when if you feel that sulfur is not working, if you feel sulfur is not working in skin complaints, if you feel silicia is not working in skin complaint, think of borax, my dear friends. Allen's keynote, last line. Skin unhealthy, slight injury suppurates. थोड़ा मार लग गया, पस बन गया. Slight trauma with the pain and the pus starts. That is borax, my dear friends. Compare that with calendula, compare that with hipparasulf, compare that with silicia and borax. Such an interesting remedy. Borax. Hello, are you with me, everyone? अरे कुछ तो बोलो यार. मैं बोलते जाता हूँ. I only keep speaking. Sometimes you also say something, some motivation. I also need some motivation. Sir, kindly tell some medicine for severe cough with mucus from last month for my wife. Dr. Nitin, yes. So whenever you have to treat your wife, first you have to treat her. Otherwise, lot of problems at home. So simple, you have to take the rubric rattling in chest. Okay. Whenever there is rattling in chest, there are so many remedies in the Mater Medica. But you must understand how is the rattling, how is the noise, and how is the expectoration. Okay. So rattling with mucus, I think this I have done before also. During cough. Okay. So whenever there is rattling during cough, there are few remedies you must think about in your, please write down so that you can never forget, because I think this is taken last time also. Somebody asked the question. First remedy everybody thinks about is antim-tart. And I've seen most of the time when antim-tart, it is given very specific, it fails. Think about, now this is a season, winter season going on and summer will start. Think about antim-tart, think about Kali Sulf, think about Pulsatilla, think about Dalkamara. Now when there is rattling before cough, khar 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 and slight cough, Drosera sepia. Sometimes rattling after cough, after खांसी के बाद rattling ज़्यादा होती है, antim-tart carboage. Hello, are you with me? Now, sometimes rattling cough ameliorates, coughing ameliorates, squilla. Expectoration, little antim-tart, without expectoration also antim-tart, but add to that ipecac, phosphorus, Viratra. Rattling cough, line aggravation, Cactus grandiflorus pulsatilla. Rattling cough in old, okay, it's your wife, so we can't tell old people. Understood, everybody? Her lungs are very weak now after she, what's her age, Dr. Nitin? Can you age? That's what I'm telling you. Rattling cough in old age. Then you must think about Hyposenium, Calibicrom, ammonium carb. So these are the remedies. Okay. Of course, there are other symptoms also. How is the cough? Which part of the lung is involved? What are the modalities? And then you can prescribe better. After COVID, you feel, then you can start with the nosode, COVID-19, 30 potency, give the patient, and the patient will be better. I've made COVID-19 medicine, so if you want, I can send you the medicine. 44 is a very young age, so COVID-19 I can send you. You can start. If you have history related to COVID-19, then you can prescribe COVID-19 30 potency, and then maybe your indicated remedy could work better. Okay, doctor. So any other? Okay, so I think brooding. Let us go for brooding again. So have you understood something about brooding? Please don't make a mistake in brooding every time given. See, I was telling you that patient, no, every time having that habit of stools, asking for stools. What was that symptom and what was that remedy? Anybody? Yes? Which symptom can we take for prescription? Okay. So that patient had brooding, constantly thinking whether that stools will come from that, whether the flush is properly. Wherever he goes out, he feels automatically. He always asks how is the flush. He will check the flush 2-3 times. So his criteria for going to the hotel was how is the flush, not how is the hotel. So this was on and on and on. So I took a rubric, brooding over unpleasant things. Brooding over unpleasant things. Surprisingly, the remedy was, anybody? I give the remedy Kissingen Aqua. Kissingen Aqua. The short form is KISS. KISS. Kissingen Aqua. It is basically springs of Kissingen. It's a water, spring of Kissingen. That cured the case. So let us go forward. Fear of falling sick. Calcarea cough. In fact, Dr. Narula, if you see exactly opposite, anxiety about health, not fear of falling sick, take anxiety about health, and then you have sub-rubrics, anxiety about his health, anxiety about health of the relative, anxiety about health of loved ones. We have remedies like Kaliars, nitric acid, calcareous carb, sepia, pulsatilla, lot of remedies. For example, anxiety about the health of the relatives, Hiparsal, phosphorus, causticum, arsenic. Anxiety about health of loved ones, carcinosin, Merxol, Hiparsal. Okay, so then I always say then you have to define that rubric. Define the patient, take the core rubric and then enter the case. Hello, are you with me? समझ में आ रहा है language? Dr. Barbal trying to be in English and Hindi both. Are you with me? Yes. So let us go forward. Anybody? Hello? Are you with me? So brooding. So today, I hope next time, whenever a case you're thinking about brooding, it is a very big rubric, and of course, brooding is a normal thing. Everybody passes through that stage of brooding, I also have it. If I have not getting good results in case, or if there are few people on the webinar, people are not understanding, I keep thinking why it is happening. But then it has to be positive and negative both. If that is affecting your health, if that is affecting your personality, if that is affecting your day-to-day life, then take the rubric brooding. Okay. Nux vomica. I have never taken Nux vomica in my life, so I can't answer that question. Very difficult for homeopath to ask the remedy. Thanks for thinking about me. Okay, so let us go forward. Okay, it's already half an hour up. So thank you everyone. Thank you for joining, and I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you until next Saturday. Goodbye.